Hi, and welcome to Creating a Total Image. My name is Maggie Varney, and I'm the founder and CEO of Wigs for Kids and the owner of Go Green Salon. I'm a licensed cosmetologist, and I have had the honor and privilege of serving adult patients in our community for the last over 35 years. I teach a program at the local cancer centers and hospitals, and once Zoom came about, we said, how can we continue to reach our patients when COVID hit over a year ago and still take care of their needs and address their needs? So I had them come here to the Wigs for Kids Wellness Center, was seeing them individually. And sometimes, as many of you know, because several of you signed up today and were not able to make it because you weren't feeling well, and you know that changes every day when you're in treatment. You just never know from one day to the next. So we talked with our wonderful sponsors and supporters, Ascension St. John. They're the ones who sponsor our program along with Go Green Salon, and said, can we do this via Zoom? So they were very excited about the opportunity to serve our patients this way as well. One, it keeps everybody safe and you're not at risk. And you know, when your immune system is compromised, you're already at risk. So, and then with COVID, we just thought this was the safest and best way to do this. So when you come to the class, I'm going to go through the class today as if it were you know, one of our monthly classes, which we do every single month usually. And we've been doing them every other month due to COVID at this time. And so today we had two models picked for today, and neither one of them were able to make it because one was getting treatment this morning and the other one is not feeling up to it to travel. So we decided, this is Miss Heather. She's one of our co-workers here at Wigs for Kids. And I said, Heather, will you be our model today? Because the important thing is that we go through the steps. Because when you come to the class, one of the first things you receive is a full kit of makeup, and it's valued at over $200. And that's complimentary. That's given to you, sponsored again through St. John's Ascension and Go Green Salon. And we get our makeup from Makeupology. They're the ones who put it together because I have to have makeup and skincare and products that have been tested for extremely sensitive skin, because as you know, when you're in treatment, your skin becomes more sensitive. So what is Creating a Total Image? Creating a Total Image is a class where we help you deal with the appearance-related side effects of treatment. And so at this time, when you first come to class, you need to fill out the application here. And that's just for us to keep a record of who attends and if we're doing what they want us to do and if they're happy with, you know, with the class. And then we have our brochure, and it explains a little bit more about the dates of our classes. So if you're not able to make it, or you have a friend who would like to come, let them know that they can go online at our website at Go Green Salon, and it's also posted at Wigs for Kids, and they can check the dates that we're having the classes this year. And then there's a booklet that you get to take home with you, and it's a step-by-step program. So if you forget anything that we talk about today, we go through it step by step. And what are the benefits of the workshop, and how, you know, we tie in not only skincare, hair care, and nail care, but we also talk about nutrition. And then there's alternative therapy as well. You know, we need to take care of ourselves. Unfortunately, my daughter just went through cancer, and she had her last treatment in January. And boy, she just did everything possible that she could to help herself through this time. And all the way from, you know, meditation to massage to relaxation to, you know, walks and being out with nature. And, you know, each of us are different. So we have our own way that we like to take care of ourselves. And anything that she could do to help herself, she did. She was drinking bone broth, and we were juicing celery. And, you know, so you will find what's right for you. You know, we are not here to endorse anyone or ourselves. We're not here to give medical advice. That's your doctor's job. You know, they're busy taking care of you and saving your life, and which is their job. We're here to help you with the appearance related issues that you will experience as you're going through this program, through this treatment. So why don't we get started? So why do we give you a makeup kit? We give you a makeup kit because your makeup is considered contaminated, believe it or not. Very few people, wash their makeup brushes out every time they use them, or throw the makeup sponge away and use a new one each time. I know very few people that do that. And if you do, that's great. But even something as simple as your mascara, you're going to see today how to keep your mascara from getting contaminated. Why are these things important? Well, you have 3 ways that germs get into the body because your immune system is compromised. So you have the eyes, the nose, and the mouth. So that's like mascara, lips, the mouth, right? The eyes, the mouth, and the nose as well. So we have to be careful, with our makeup. And you say, well, makeup is expensive. That's why we start you off with a new kit. And so I usually have my guests bring their current makeup in, and I teach them what we can salvage. If it's a lipstick, then we can use an alcohol wipe every time you use it, and you can continue to use it. If it's a lip gloss, we have disposable lip pencils that you would use, and you would just wash the lip pencil out. You wouldn't use the pad on the end of the lip gloss. So these are different things that we'll discuss today. That's why we give you a whole kit of makeup. Everything from concealer to foundation. So eyes, where do you put color? The eyes, the cheeks, and the lips. So we want to make sure we cover it all. And we even throw in some nail polish. We want to make sure that the polish that you're using currently and how you're caring for your nails, we'll discuss today as well, that it is formaldehyde free. So why don't we get started? I usually start out with the wigs first, because most people, if you've never worn a wig before, you don't know what to expect. So, some of you came to see me personally, and I've already worked with you. Some of you are at the beginning of this journey. Some of you are in the middle of your treatment, and some are almost done with treatment. So wherever you are in this journey, this class is appropriate for you. So one of the things that some people choose to do is head coverings. They don't choose to have a wig. And you know what? That's okay. And you can find wigs that are really cute, like this hat is reversible. It's really a cute hat. I think I got this at Vincent's Medical Supply. So you can find them all over. I also find a lot of them at Burlington. I used to get them at Burlington. So it doesn't have to be expensive. You put on a nice pair of earrings with that and an outfit, you're good to go. That's the whole point of this class. You don't have to look like you're ravished by the disease. And it's true, ladies. If we look good, we do feel better. So I think that's very important. And this is a nice hat. You see how it's decorative, but look how warm it is. And when you don't have hair, it's cold out. You lose 40% of your body heat through the top of your head when you don't have hair. So it gets cold when your hair is gone, but you don't have to go around bald. You can go around looking quite fashionable. So there are options. And then of course, wigs. What kind of wig should you get? What would be appropriate? What are your needs? What best meets your needs and your budget? So I would recommend that you work with a professional, obviously. You can go to a wig salon, you can go to a wig shop, and they even have wig banks that you can visit and try to, get a wig. But I'm telling you, no matter where you get your wig, it has to be customized to you. It has to be fitted, even if it's out of a box. It still has to be fitted, even if it's not custom made, so that it looks like it's custom made for your head. So, and there's different types of wigs. People will say to me, well, in this magazine, I saw a wig for $29.99. And what's the difference in that and a wig that you have here? Well, the difference in the prices is always based on the cap construction and also the material, if it's human or synthetic or a blend of both, and the length. Those are the 3 factors. So the longer the hair, the more expensive the wig will be. If it's hand sewn, this is a machine sewn wefted back. This is a mono top, and this has a very small lace front. So that looks the most natural. It's very lightweight. It looks like it's growing right out of your scalp, which is what most of us want to look like. You know, my patients go for treatment and the doctors or nurses will say to them, I can't believe you haven't lost your hair yet, and you're sitting there with the wig on. And that is true, and it can be possible for all of you. And it's just a matter of knowing how to care for it, which we're going to go over in a little bit as well. So this is an example of a wig. This is a synthetic wig. This is not a human. There's three different types of wigs as far as the materials. There's the synthetic human blend, and then there's the human. And as you move up in that rank, the price goes up as well. So as you move up in that rank of, you know, most wigs are wefted and machine sewn. That's going to be a lot less expensive than hand sewn, where every hair is hand sewn in there. So that's what the price is always based on, just so that you know. And if anybody asks you, if you're at treatment and somebody says, you know, I don't know where to go for my wig or how much I should pay or what I should do, you know, just remember that you have choices and education. A little bit of knowledge is, wisdom is powerful, you know, and nobody wants to get ripped off, but also nobody wants to. I've had ladies who went and bought, this is the truth, 3-4 wigs, and they don't wear any of them. They're itchy, they're picky, they don't fit, they're not comfortable, they fall off, they're too tight. So I said to this one lady, for what you paid for all 4 of those, you could have had a human one. And she said, I know. So don't be one of those people making that mistake, or don't have your friends do that. You know, let them know that there are specialists out here, hair restoration specialists, who can help them. And do your homework and do your shop around, you know what you're getting. Most importantly, work with a professional. So is there any questions with the wigs? If there is, you know, please speak up, and we're going to go into washing and cleaning them later as far as the different types of wigs and the pricing. That's what that's based on. No? Okay. So then we'll move on to the next part. The next part I like to talk about is the nails. You know, you don't think about it, you know, when you're in treatment, but why does chemotherapy affect the nails? Well, the hair, skin, and nails, this is the skin part, the hair, skin, and nails, it's all made up of keratin protein. So, and it's a fast growing cell. So that's what cancer is, a fast growing cell. So in here, we have some tips on nail care as well, and recommendations. When you are in treatment, it is recommended that you do not go and get manicures and or pedicures at this time. If you need your toenails trimmed, they recommend that you go to a podiatrist, and your insurance will pay for that. And I have had clients, guests, who have insisted, I've lost my hair, I'm not giving up my nails, and ended up that their whole nail fell out off of the nail bed. We don't need that. What is normal is that they could split, peel, discolor, but you should not lose them unless you have weight on there that would affect it and pull it away from the nail bed. So we don't recommend absolutely no cuticle cutting, because again, that opens you up to infection. And if you do want to file your own nails, if it's with your own file and you disinfect, you know, wash your file with soap and water, antibacterial soap, and then you clean it with alcohol after, you know, you can file your own nails, just don't file the skin to the point where, you know, you cut yourself with the file, which you can actually cut yourself with the file. So just be careful. So you can file your own nails with your own file as long as it's clean and you clean it after each use. But you should not be cutting the cuticles. Use a cuticle oil. And I highly recommend that you use a cuticle oil. Any cuticle oil, I don't care whose, and you put 1 drop on each finger, and you massage it in every night before you go to bed. And it helps with sensitivity, splitting, brittleness, and even discoloration. And so, and you can also put those on your toes. The kids in my program was saying, Miss Maggie, that the sheets, you know, irritate my toes when it rubs on them because they're so sensitive. And so I tell them, put the cuticle oil on your toenails too, and that will help as well. So you may find that to be helpful. But formaldehyde to nail polish is the same as salt is to food. It's a preservative. That's why your nail polish lasts for so long. So we recommend that you use formaldehyde-free polish, and that, you know, and there are companies out there that carry them, you know, like Sally's Beauty Supply. They sell to the public. You don't have to be a licensed professional. I know that Sally Hansen has one that's formaldehyde-free, you know, or ask your nail tech what she would recommend. But I know OPI has one professionally, that they have one as well. So there are many out there. The one that we carry is the Emma line, and it has no formaldehyde in it. And it's healthy. It's a healthier nail polish. Same thing with nail polish remover. You don't want to be using any kind of acetone at this time at all. You want to use, it's called, you can use nail polish remover as long as it's called conditioning nail polish remover, because it has, there's 40 different grades of alcohol, and you want to use the one that has the best alcohol in it, not the dry, extremely drying one. So if it says conditioning nail polish remover, that's the one you want. I don't care who it's by. So that's just a little tip to help you keep your nails looking nice, you know, again, because it's a part of our appearance and our part of our looks. And so, and it does, the chemotherapy does affect that. As you guys know already, you're in treatment. You know how dry the skin and the nails and the hair gets. It becomes brittle and it breaks off. And so anything you can do to lessen the sensitivity and make it look nice, that would be great. So now we've covered the nails, and we've also talked about the wigs, and I'm going to show you how to wash one, you know, how to wash your wig and go through the steps with you. But I thought before we do that, at the end, we'll do that, but maybe now we'll do, and I mean, inside your packet, you all received already, or you will receive, you know, caring for your human and synthetic wig. It's step-by-step instructions. So if you forget anything I say, because you've got chemo brain right now, which is like a little fog going on, don't worry about it, because you have the instructions right there. And if you have any questions after that, you all have my phone number, and my number's on all of our literature. And you're welcome to call me or email or text and let me know, you know, if you have a question, how I can help you, and I'll certainly return your call.
Maggie?
Yes.
Maggie, this is Mary.
Yes, ma'am.
Hi. I'm one that tends not to use nail polish at all. However, I'm noticing some of my nails, especially my pinky, is starting to have almost like a crack in the nail. Would it be an okay thing, like, to put on nail polish for a small period of time, hoping it'll harden my nail, or what would you suggest?
Have you been using the cuticle oil every day, twice a day?
Not every day, no, not every day.
Okay.
More on my toenails actually than my nails.
Right. Well, that number one, that would help. And if you have a crack there, the only thing that it has to, you know, once it's cracked like that, you know, usually it has to grow out. If you were able to go to a salon and you weren't in treatment, I can make a different recommendation. You know, we could do a repair. But because of what's going on, all I would do is I would get some nail glue, and I would fill that crack with nail glue, and just on the crack. And then I would continue to use the cuticle oil on the cuticles every night. And then you may be able to put, see, the thing about putting a nail hardener on right now is it hardens the nail. The nail's already hard and brittle. We don't want it to get harder. So normally that would work, but right now that will not work. So I would not recommend doing that. I would just put a little drop of nail glue, 5-second glue, like, you know, nail glue just on the crack, not on the whole top of the nail. And you'll have to do that like every couple of days, because that washes away eventually, you know. And so then I would just line that right up and let that set and let that grow out. The only thing you can do right now is let that grow out. But if you put the hardener over the whole nail, then the cuticle oil will not be able to soak through the nail. Where it's not just for the cuticle. I want you to use it for the whole nail.
Okay. The
So
whole
they're
nail.
not so brittle, but that's a great question. Thank you for asking.
Okay, well, my next part of my treatment is going to be radiation. So I'm
Oh.
having a break from the chemo, so I'm hoping that that nail will maybe get its act
Yeah.
together a little bit more.
It's amazing. When you get a break from chemo, your hair will start to grow back right away. Your nails will start to get better. Because it's a fast growing cell. So everything starts to improve. You'll see that it will.
Well, I don't know if it's okay to say this at this point or not, but I never lost all of my hair. Even though you shaved my head, I
Uh-huh.
still had a lot of stubble. And I
Did you?
have, and I have some pieces that are probably about a quarter to and half an inch long coming out of my hair. So I didn't know if the other individual that, is it Anne? If I'm sure all these chemo drugs are different. I know they are, but I was really surprised. I never lost all of my, I have stubble. I have stubble.
Yeah. Well, and how long were your treatments in between?
3 weeks.
That's why. Because
Yeah.
the minute you stop, the minute you have your chemo, then it starts to grow back. So that's why you keep getting stubbles. That's why you keep getting stubbles. Then you have 3, but people who get it every week, that doesn't happen, or every 2
Okay.
weeks.
I
So
see.
that's one of the reasons. And you're right, it's a combination of medications which causes the hair only to thin and some people lose it all. But when you were here, I saw a lot of spots like where you were balding. So probably yours is growing back in between the 3-week treatment. Yeah.
I see. Okay. Okay. Thank you.
Yeah, that's a good question. Okay. So I think what I'll do is we'll get started here with the makeup because that's always, girls, we like to play with makeup. So since Heather and I work together and she's at my house all the time, she's like my daughter. And are you comfortable with me not wearing a mask while I do your makeup, honey?
Yeah.
I've had my double shot. So,
Yeah,
I'm
good.
Yeah, you're good? Okay.
I'm good.
Because I will be happy to put that on because I'm gonna be closer to you.
I'm good.
Okay, all right. So let's start with concealer. So when I look at Heather and I say to myself, I'm going to use this, when you come to the class, you get a disposable package of tools. You get some cotton pads, some cotton, some sponge applicators, some Q-tips, disposable wands, and lip pencil. So I'm going to use the same tools, a lot of the same tools that I'm going to give you guys. So when this class is over, then you come by like a drive-by and you pick up your kit of everything that, your makeup kit, and then you get to go home and you get to play with it. So when I look at Heather, I see some darkness around her eyes here and some deepness here where I would like to lighten that up a little bit, maybe a little bit right there. And I think that's it. She has a little bit of blemishes right here. I'll cover up maybe a little bit here, because she's, believe it or not, how old are you, Heather?
38.
Does this woman look 38? No way. Okay, so when you're using your sponge to do your concealer, the thick end of the sponge is where you use the concealer. The thin end of the sponge is where you do the foundation. So I'm going to use the thick end of the sponge, and I'm going to put her concealer on. Look up the ceiling. So if there's anything that you want to blend in, and it's kind of like, I think of an artist and a canvas. You know what they do? They remove any imperfections in the canvas first before they put the paint exactly where they want it. Well, it's the same way when you're doing makeup. You want to erase anything that may show through. A lot of people, I can't get through there, Miss Heather. You're gonna have to bring your chair a little more forward. Or a little more back, maybe a little more back. Thank you, good. Thank you. And a lot of people who are in treatment, believe it or not, one of the side effects is they get acne. So this, or blemishes. So your concealer will help with that before you put your foundation on. People will say to me, "Well, I don't understand. I put my makeup on at 6 in the morning and by 10 o'clock it's all soaked into my skin." Well, it doesn't soak into your skin. But if you don't prime the skin first, which makes a difference, you want to use a beautiful moisturizer on it. And let that set for about 3 minutes before you start applying the concealer and the makeup, the rest of your makeup.
Maggie, what kind of moisturizer do you recommend?
There's a lot of different kinds, but honestly, what I use is what my dermatologist recommended, and I used to use, because I'm in the industry, so I used to use pretty expensive skincare products. And I realized that the one that he recommended, CeraVe?
CeraVe,
Huh?
CeraVe, or Aquaphor.
No, not Aquaphor. Aquaphor is for the lips, for the corners of the lips, and for corners of the mouth and for the lips. It's
CeraVe.
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 Yes, yes, very good, yes.
That's what he
Okay.
recommended. Honest to God, I use that now for my body and also for my face. My daughter said to me about 2 weeks ago, she said, "Mom, I need some moisturizer." And I said, "Well, and she said, "You're kidding." I said, "No." I said, "I'm telling you, I started using it and it works great."
Yes,
And,
I actually use that now, and I get it with sunscreen, so it's very good.
Good. Isn't that amazing? And it's not expensive.
No,
And it's not greasy and your makeup isn't shiny.
right.
You get some makeup and, some can moisturizer, and then you put your makeup over it and your makeup is shiny and you look like a little grease pig. So you want to have that nice supple look to it, but you don't, we're not a teenager. No. Okay, so we just kind of like put some concealer where we thought was necessary, but that's not her foundation. That's just her concealer. Do you even feel that on your skin? It should be very light. Yeah, it should be very light. Okay. So now what we're going to do is our foundation, and I'm going to show you a little trick with foundation. And this is a professional trick. And so the thicken you use as I said, for the concealer, and the thin end you use for the foundation. And then the other side is your eraser. So if this is your foundation, this side is your eraser for blending. So you put it on the sponge first. I only put about the size of a dime. I don't put very much on. Shouldn't need a lot. And you work it into your sponge like that. That's a trick of the trade. And it's soaked into the sponge, because when you just put it directly on the face, it's like all of a sudden you run out of foundation. So, and then you bless yourself. 1, 2, 3, 4, 5. Okay, now I have enough left in my sponge that I should be able to get her whole face done without having to add more. So I go up like a butterfly until I run out in the hairline. So then I use the side of my sponge so that I don't get it into her hair and it blends out. So you don't see a ring around the face. That's what we don't want to see. Okay. If you want to deposit, you want to pat. Otherwise, you take long strokes to blend. When you want to cover something, you pat to deposit. Long strokes, again, to blend. So you don't see where her makeup starts or stops. Close your eyes. I don't put makeup separate on the eyes. I just take what's on the sponge and I blend it. Turn your head this way, please. Look up. Let's see. Close your eyes. One more. How does that look? Let me show you in the mirror. How does that look to you? Good. Good. Does that look good?
Mm-hmm.
Good. Okay. So now when you're putting makeup on, you always want to put cream on cream. So this is a cream foundation that we use. So now we're going to put a cream blush on. You can do it two ways. It's your own makeup. So you can do it yourself with a pad if you want. So you can throw it away after. You can put it on like that. But it heats up if you use your hands. Most people will use their hands. Yeah. When you put blush on, you want to, you don't want to say, here comes my blush. You want to see a flush of color, not too much, just a little flush of color. You don't want to see where it starts or where it stops. This is like a real sheer blush. Of course, she's pretty anyway, so she just makes my work look good, you know. That's our Heather girl. Okay. Now you can use powder. Once you put cream on cream, you can use powder. This is a trio powder. You can use the light one, the medium, or the dark, or you can blend them if you want over top to set it. Now, I don't use powder on the whole face, but I just take what's left from here to set the makeup, because if you powder the face too much, it shows every line, crack, and crevice. So we don't want that. So you just, less is more with powder. Now, this was we were laughing about this. We got this in the packet. Let me show you, Heather. This is, it looks like a shot, like you've not had enough of those, right? It comes out like that. It's a moisturizer. You want to put that on your hands? Look at how red your hands are on top. This is really for your face. But I just thought that was kind of cool. They're always coming out. This is for in my teen packet. But you know, they got to have something fun for the kids, right? So we also do a class for our teens as well as our adults. So our makeup kits are a little bit different. Okay. So now, Heather, it's been a while since you had your eyebrows done, isn't it?
Mm-hmm.
But you have beautiful eyebrows. So we're still going to fill those in a little bit. So here's our eyebrow pencil. And it's dark. And when you're filling the eyebrows in, when you're doing the eyebrows, you want to go straight up on the side of the nose. Make your first dot. That's just about where her eyebrows are. You want to go from the corner of the nose to the corner of the eye. That's where they should end. And then look straight ahead. On the outside of the color of the eye is where the arch should be. So because you're not in treatment, obviously your eyebrows, you've not lost them, so we can just follow your natural brow. But for people who have lost their eyebrows, it's kind of hard. How do you figure out where the arch
Right.
goes? And, doesn't it make sense?
Yeah.
So we're just gonna fill these in a little bit. But you want to take short strokes. Because even though you haven't lost your eyebrows, nobody's eyebrows are perfect.
Right.
So what we try to do is just fill them in a little bit with short strokes. But right here, this is your natural arch. That's not what I put in there. It's your natural arch. Oops, Stephanie. Then you can take the other end of it and you soften it. Then we have something called a brow stay. It's clear, it looks like mascara. And it keeps, as we get older, our brows get gray in there and they get wiry, and this kind of helps to keep them in place. So can you see the difference from one brow to the other? Look at that. Let me show you.
Oh, yeah,
Looks nice, doesn't it?
it does.
So now our people and people like myself, who, as I've aged, my eyebrows start in further, they end shorter. And so I have to fill them in. And so it kind of helps when you rub your eye, you don't want it to smear all over your face. So
Right.
it kind of helps if you have a brow stay like that, because then what you put on there will stay better for you. So let's do your other eyebrow and kind of match that up. You're gonna get your eyebrows waxed pretty soon. We haven't been open to do eyebrow waxing because of COVID, right?
Right.
So short strokes. Lighter hand. It's like when you're painting a picture, you want a light stroke for softness. And even though she had beautiful eyebrows, like I said, nobody's eyebrows are perfect. So then what I do, I need to get my wipes. Then what I do after I use my tools is I disinfect them right away. So I never put them away without cleaning them. So it's ready for the next time that I want to use it too.
And Maggie, what kind of wipes do you use? Do you use Lysol wipes?
I don't use Lysol. I buy the baby wipes, believe it or not, or the ones at Costco's. And so I wash, when I'm done, like I wash my brushes and everything in an antibacterial soap. And then, but in between right now, whenever I'm using stuff, I use the baby wipes to clean it, to put it away. I don't want, and it's your makeup, so nobody else is gonna grab it and use it,
Okay.
Well, if somebody else was using it, I have an actual spray that I use. It's an alcohol spray. It's a brush spray and a cleaner that I use for our makeup station. Okay. So, all right. So now you can use liner underneath the eye, because when you don't have lashes, which Heather does, but when you don't have lashes, you want to look like you have lashes. And so if you wear a really hard line, then it draws more attention that you don't have lashes. But if you put a little soft line underneath there, that usually kind of works. Let me see. You wanna look up for me? Up. Yeah. No blinking. It's hard. Somebody's coming near your eye, isn't it?
Mm-hmm.
You just keep looking up, you'll be fine. Yeah. Now, because Heather has darkness around her eyes, I don't want it too dark, because when the body heat warms that liner up, it kind of melts into the skin, and then you get these dark circles around your eyes. You already have an issue with dark circles because you have allergies, so we don't want to do that. But do you see the difference one eye to the other by lining it underneath? Look at the difference.
Oh, yeah,
Doesn't it look nice?
yeah.
It's very soft. So if you didn't have lashes, for our ladies who's watching, it would at least make them feel like they had lashes. So it's a rock, look up at the ceiling, it's a rocking technique, and you don't draw a hard line, you just go back and forth. And you go very soft. Let me see. Yeah, that looks nice. Okay, good. And then if it is too hard or you want to make it a little softer, then what you do is you take your pointed Q-tip and you can go in here and look up. You can go in here and you can blend, or you can touch up if you wanted to, if there's something you have to do, or the flat pad of your Q-tip, you can get in here, smooth out anything that maybe you don't want in there, that, you know, it's creased into the creases. Okay. You can get a whole container of those. I just bought a big container of them at Sally's the other day when I was there, so they're not expensive. And your lips are very dehydrated. So are you using any kind of a lip treatment for your lips, Mother?
Not really, no.
This one's good. That one's good. Okay. So same thing with this, as with the mascara, which I'll show you in just a minute. We always use disposable mascara wands here at the center because we have, you know, in our makeup bar, because multiple people are using it. So we don't want to take a chance on an infection, of course, for anybody. So this is your mascara. So if you pump your mascara, it will force air in there and it will dry the mascara out sooner. So you don't want to do that. What you want to do is roll it back and forth. If you're going to use the mascara wand, we don't recommend that right now because you're in treatment, but when you're done with treatment, take your disposable brush, put it in there, roll it back and forth, pull it out. You should have enough in there to do both eyes. Close this back up. Now this is sterile. When you do your own eyes, what I do is, what I recommend is you look down, reach over your head, look down, pull your lid up, and your lashes will stick straight out. So, and roll it on. So look down, no, not your head, just your eyes, look down at the floor. And when I pull her lid up, then I just roll this on. So you put it up against the eye and you roll it out. So you don't have big clumps too. You can go on the top if you wish to. Separate it with the tip. Let's see, look over this way. Thank you. Look up. I'm just taking the tip that has a little bit of mascara in there. I'm just going back and forth gently. Now look down. Now, look up. If you have any that you got on there, You roll it off. Don't smear it. Take your Q-tip and roll it off, and it can't lift right up. If you rub it, you smear it. Look how much was still left on there. So as you can see, there's enough on there. When you do that once, there's enough on there to do at least 2 applications of mascara. And then I wash my brush out. I'm getting warm, so I'm going to take my jacket off. Okay, so now we have the lips. Now your lips are really dry, really dehydrated. Do you not use anything on them at night?
I've been putting chapstick on.
Well, why don't you get some Aquaphor and try that instead?
I think I have some at home.
Why don't you try that? I think that might work better because your lips are so dehydrated. And so, and then you peel them and pick them and you get sores. You don't want that, right? Okay, we want to try to avoid that, especially with our patients. So why don't we put a little bit of this moisturizer on your lips? How's that? I'll give you a shot of it. How's that? Okay. Put that right on there. See if we can moisturize those lips a little bit. Or we try to do anything with them. Open. Okay. Now can you blot your lips with that on there? When the lips are that dry, it's almost impossible to get a nice smooth look, you know. And I tried this on you earlier for skin tone to make sure that it matched and it looked nice, and it did look nice. So we're gonna, this is a nice neutral color. Now you can line the lips. What I like to do is I line my lips. Good. I usually will line my lips and then put the gloss on. Because right now, you do not want to use matte lipstick because your lips are already dry anyway. I want to stick that back in there again. And ladies, something I want to tell you, as we age, our top lip gets smaller, our bottom lip gets bigger, our nose gets longer, our ears get longer because of gravity. It's just a natural fact of life. And so usually as we age, we want to go on the inside of the bottom lip and on the outside of the top lip. And also, as you age, our bow seems to flatten out in our top lip. So we want to accentuate the bow. Your bow is just fine. It's very defined. But that happens to us as we age. So if you want to look younger, just automatically, if you do that, that helps. So I'm going to grab a lip liner and have you take a look at this real quick, because I want to show them what I would do with the liner for your lip.
Pretty.
Doesn't that look pretty? What do you think, Mother?
I like it a lot.
These crayons that you can use to line your lip as well. And so this is much thicker. Open up. And that just gives it a little bit more definition over here. Okay, and over here. Your lip is starting to disappear in the corners. So open more. And just a second. Need a lip pencil. Let me give you some lips again, Heather. I make some lips on here. That's what we have to do. As we age, we add just fill in where we don't have it, right?
Mhm.
So that's what we want to do here. Just now blot your lips real good. So. Blot your lips good. Okay. Oh, your poor lips are so dry, honey. They are. Now you got lips on the side though, too. What do you think about that? Look at that. Look in the mirror at that. Let me add some gloss to that.
Mhm.
What do you think?
Mhm.
You gotta add a little more shine to those. Okay, so you just gotta play around. There's nothing better than shine. Shine will help those wrinkles. Oh. Now, only put it on the bottom lip when you add the shine. And then you blot because it melts with the body heat. Now blot your lips. Okay. What do you think? Ooh, huh? Okay. But it gives you a fuller lip look, and a lot of people like that fuller lip look. What do you think? Is that okay for you? Are you comfortable with that?
Mhm.
So it's kind of fun. You can just play around. But you want to add shine. That color that we used on you. Let me see. The color that we used on you was a brown, but boy, it showed every little wrinkle on your lip. So we don't want that, do we?
Mhm.
No. I'm going to blend this so it looks really natural. So what do you ladies think? Doesn't she look pretty?
Yes, it really brings out all of her features really nicely.
Doesn't it? Yeah. But you see how even somebody her age, they start to lose their lip on the side here. No lip at all on either side. So you want to fill that in, especially if you're doing photos or a wedding, you're going to a wedding or something. Now she looks like she has lips. All right, what do you think, Heather?
Mhm.
Yeah, okay. All right, is there anything you want me to change? Open up, open. Anything you want me to change or anything different? Because you know what, it doesn't matter what I think, it's what you think. You know, you're the person who has to wear it. And we're all about natural. And so we also, you know, have eyeshadow that we can do. But the thing with doing the eyeshadow on you, I'm going to do your eyes different than I would do Mary's or somebody else's, right? Because it's
right.
always based on their face shape. And remember that the face is divided into 3 parts. You know, it's from the forehead to the bridge of the nose, from the eyes to the corner of the lip, and from the lip to the chin, which is the largest third on her. The smallest third is the lips. That's why I put a lot of focus on her lips. She has gorgeous eyes, great cheeks, nice high forehead, but her lips did not speak you know, as loudly as the rest of her face. So I wanted to really have her lips pop. So is that too uncomfortable for you to have lips like that? No, no, you didn't even have to get injections, right? Okay, was that fun today? I
Yeah.
hope that you enjoyed it. And
I did.
so as, you know, if you want your eye makeup done, then, you know, for each person, it really has to be individualized for the person. Because each one of us, our face shape is different. You know, Heather has a beautiful oval shaped face. And so when you take her hair down, she has pretty hair, kind of long and stringy like mine, huh, Heather?
Yeah.
Yeah. Yeah, we wish our hair was thicker. Well, we can make that happen in just a few minutes, right? So, there you go. Isn't she beautiful? And thank you for being our model.
Okay.
Good, let's give her a hand.
Thank
Good
you,
job.
Heather.
Yay, good
Thank you.
job. She goes,
I don't think, you know what, from the Zoom watching, it doesn't even look like she needs any eyeshadow. She's got, from here, it looks like nice, just a nice color above, between her eyebrows and her.
Doesn't she?
Yes, yes.
Yeah. Now, I've done her, I think I did your makeup once for Gail, or we had it done. And we did it real dramatic because she has almond shaped eyes. So you can imagine, you know, bringing that out. But we've never done like an everyday look for her for work. So I thought this would be a good opportunity for her to learn as well, right?
Yeah. Very
Okay.
nice.
Thank you, Heather. All right, so why don't we go into my room? Miss Heather, you can take care of this if you would for me. And then we'll go
Okay.
into the room and I'll work with the ladies and you're off the hook now, right?
Okay.
I'm gonna bring our wig with us because I know many of you asked me about how do I clean my wig properly? What's the proper instructions that I need for my wig? So I would like to go over that with you today. You take your wig and you turn her inside out, just like this. You make a sink of water. So I will use my shampoo bowl because I happen to have one, but you would make a sink of water. And you want to wet your wig down first. And if it is a synthetic wig, you cannot use, you know, a lot of wig places, I don't know why they do that, but they say, oh, just use baby shampoo. No, you're not supposed to use baby shampoo. It has oils in it and the wig will never have the same look to it if it's a synthetic wig and you do that. So what we, and honestly, the shampoo and conditioner that we use, the whole bottle is gonna last you the whole year of your treatment. And so I always say you have to use twice as much shampoo as you do conditioner. So you use a pretty generous amount, okay? So people say to me, how much? And I go, well, you know, the palm of my hand. You know, and I lather it up in my hands first. And I pick up the wig, it's inside out and it's wet. Then I take it and I massage it in the cap. It's very important that you don't rough it up, whether it's human or synthetic, it makes the wig matte and tangle. So I usually go about 3 times through the cap like this. Once I get it all through, then all the soap goes through to the other side. Then I hold the wig from the front and I just squeeze the soap out of the wig down the shaft of the hair till I get most of it out. When you're doing that, you're also cleansing the hair of the wig at the same time. You know, it's not the hair that gets soiled, it's the cap. And honestly, if you don't shampoo the cap can rot. I've had kids who say, no, Miss Maggie, really, I promise you, I'm shampooing every 2 to 3 weeks. And And I go, honey, the cap wouldn't be rotting like this. Because everything that goes in your body comes out through your scalp. And so when you perspire or just daily living, that's what happens. So you want to make sure the water is tepid while you're rinsing. And you rinse to make sure all the soap is out. Tepid water.
Okay, yeah, I have a question.
Yeah.
Can the chemochemicals affect the wig? You
It
said
can.
anything that comes out through the body?
It can. Not only, it doesn't rot the cap, but the smell gets in there and it's hard to get it out because it's a chemical. And so it's hard and you can smell it. So that's why it's important to wash the wig every 2 weeks. Every 3 weeks if you rarely wear it, go once a month for sure. Good question. So I squeeze the water out, take my conditioner. And I use about half as much conditioner as I do shampoo. Now, when you're conditioning, you want to focus on the hair. When you're washing, you want to focus on the cap. So when you take you just rub it in your hands like hand lotion, and then you rub it all through the hair. Make sure you get it all over. Squeeze it off your hands, go down the shaft. Then you take a towel and a wide tooth comb. And I take it over and I lay it on the counter. With the cap facing up at me, especially if the hair is synthetic. You always comb the back first because it mats and tangles usually. And I comb the outer perimeter, then I flip it over. I hold the hair so it doesn't come out by the roots, and I gently, with a wide tooth comb, I gently comb the conditioner all the way through the wig. Then I pick it up, and if I run into a tangle, I don't rip at the hair. I set it back down, start to comb it from the bottom up again until I can get that tangle out. I comb the conditioner all the way through. Then I take it back to the sink and I rinse it. I rinse the inside of the cap first, even though I put no conditioner on it, because if you have a hand-tied wig and you put a lot of conditioner and you rub it on the cap, it makes the knots come untied and they slip. The hair slips out. So, but when you do rinse the conditioner, you do want to leave about a third of it in there because you want the hair to feel silky and smooth. You only wash it every 2 to 3 weeks. So you don't want it squeaky clean, dry, without no conditioner in it. So you want to leave and you squeeze, squeeze, squeeze. You don't wring the cap. You don't go like this and wring it. You squeeze, 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 squeeze to get the moisture out. Then you take it, you wrap it in a towel. And I usually knead it like bread. Back and forth, get the moisture out. If it's long, believe it or not, I'll take it. I'll wrap it up. I'll drop it on the floor. And I'll step on it so I can get all the moisture, because if I hang it and it has really long hair, it's going to stretch the cap out for the kids, Or my adult patients. Some of my adult patients have long hair too. Then you take it, you shake it. With the synthetic wigs, you don't have to do anything to them. You don't have to blow them dry. You can't use a curling iron on most of them. Otherwise it melts the hair. So unless it's a heat-friendly fiber, if it's a heat-friendly fiber, then you can use a curling iron on them, but it has to be a certain temperature or you'll cook it. So, and you don't want to do that after you paid $300, $400, $500, $600 for it. This is a drying rack. This just pops together like this. This is a great traveler. If you don't want to take your styrofoam head with you and you say you're going in the hospital to spend the night or you're going away on a vacation, you don't want to travel with that. This is collapsible. You put your wig on here and you let it air dry. When your wig is wet, it goes on the drying rack. When your wig is dry, it goes on the head form. No, it's not something that you should throw on the nightstand, because one side of it's going to be flat and it won't lay right, and you have to wet it down and start over. And that's true. And with the synthetic wigs, the style is baked in there. A lot of people say, well, I'm afraid because if I wash it, it won't look the same. It will look the same because the style is baked in there, believe it or not. It's baked in an oven. That's how it's actually baked in there, and that's why it stays. So that's for synthetic or human. Then what I do the next day, I take and I put it on my head form, and I have T-pins that I use. And I put one in the front, one in the back, and I put it on my head form, I section it, and then if it's human, then I flat iron or curl it. If it's synthetic, I don't have to do anything to it. That's why 95% of my wig recommendation to patients who are adults is synthetic. The difference in the two is the human ones are more comfortable. They just are. Because it feels like a more natural fabric against your face and your neck and skin, because it is. And but the synthetics that they make them out of today are very nice as well, and they look so natural, and they're also less expensive. So, and when you're a patient and you are in treatment, you would be in treatment probably about a year. But when you're an adult, when you're a kid and you're in treatment for 3 to 5 years minimum. That's why 95% of my kids is human. And kids are different. They want to flat iron, they want to curl, they want to do things with their wigs to make it look nice. They like that. They're kids, they like change. So now talking about change, let's talk about some more changes. Look at all those wigs there on the wall. Those are some of the wigs for our kids, but my adult patients come in here and get their wigs too. So some of them say, no, I don't want a synthetic wig, I want a human one. And I don't care, that's what I want. And they're happy with it. You can always drop it off here and you can have us service it, which is great. We're happy to do that for you. And now I want to show you a couple more little things and tips that you can do as your hair is growing in as well. Maybe it's you have an event or something coming up. You can always do something as simple as this. You can add a top piece. Let me show you how this works. It's real easy. I have a drawer full of them. Because 1, I like to try them out before I give them to the kids. 2, as I've aged, my hair has gotten thinner. And also after my surgery, and I too am a cancer survivor. And after my surgeries and medications, and my hair never came back as thick. But that's okay, I have hair, so I'm not complaining. But sometimes I like to enhance it. So I just put some hair on. And this is an option. This just snaps on. Just like this, and instant hair, because with my fine thin hair, I can't do some of the things that I want to do with my hair. So if I want to wear a braid, or I want it thicker, or I want to wear part of it up and part of it down, instant hair. Pretty amazing, isn't it? Look at that, girls. So if your hair comes back and it's thin, don't worry about it. Isn't that amazing?
Yes.
Look at the difference. And this is a synthetic piece. This is not a human piece. So this is not real expensive, but you would never know it because I've cut it to go with my hair. I picked the color out to go with my hair. Who would know, right?
Wow, yeah.
So, and I wear it. I wear it often, especially when I have interviews and stuff, because my hair is so fine and thin. And it's rainy outside. So and my hair is curly, it frizzes up. So I just plop this on and I'm good to go. So when I tell you I have a drawer full of them, I'm not kidding. I do, all different colors and sizes and lengths. Because one, I like to try them out before the kids, you know, and the adult patients use them. And I want to make sure that they hold up well. But sometimes, and you don't even feel you have it on, it's different than a wig. So there's, you know, when your hair's growing in, as long as we have something to snap it to, we can always, this is always an option that you can consider as well. Look at the difference. Okay, now if I don't want to wear a wig, but maybe, you know, I want to wear my hair back, but you see how thin my bangs are? So I'll go, you know what, but this is human. So I'll go, you know, I'm gonna just wear my bangs today. And I plop these in. Let me see. So you see how easy this is, girls? This is like easy peasy. Comb it back. Put my hair up in a ponytail. Get it out of my face. There you go. Isn't that amazing, girls? Pretty cool, huh?
So you said there's snaps in it. I mean, what do you snap it to?
If you have hair, when your hair starts growing in, but it's not long enough yet, you know, as long as you have hair to snap it to, you can wear these and make your hair look thicker and fuller.
So it snaps into your hair? That's interesting.
Yeah, it snaps right onto your own hair.
Huh.
But it makes you look like you have thicker, fuller hair, which is really nice. And so, and then if you're, I mean, why do you think these movie stars and these people have all these different looks? That's how they get them.
Okay, yeah.
And I mean, these are synthetic. So I'm telling you, these are not expensive pieces. These are inexpensive pieces. And you're going out to a wedding or you're going someplace and you know, you want to go out in the evening. You take your hair. I got the bangs in already. I put my hair in there and I'm good to go.
Wow.
Okay. So
Yeah. Wow.
I'm just saying, we have options. We have lots of options that we can do. And it doesn't have to be very costly. Any questions?
I am using the shampoos that I purchased from you on my
Yeah.
scalp.
Yes,
But
good.
I still in between have itchiness, you know?
Do you? How often are you using it?
Well, here comes my dog, of course.
Oh,
Hang on one second.
I visited this earlier, yeah. So, you know, that happens, the dryness, the itchiness, that happens. That means you need moisture. You need more moisture in your hair, on your scalp. People think, oh, well, I don't have hair. Why do I have to shampoo it? Well, you have to shampoo it because you still have a scalp. You still have to cleanse the area and you still have to moisturize the area. So I tell everybody, when you're done washing your face and you put your moisturizer on your face, just keep going over your scalp. That will help with that dryness and itchiness.
Yeah, actually, I have been starting to use the CeraVe on my scalp at night.
Oh, good.
Just
Good.
because
Yes.
it does itch. And I initially, in my third treatment, I had like acne in the back of my scalp for a while, but it cleared up.
See?
Yeah.
Well, that's what I was saying when I was working with Heather earlier. I said, you know, some of the side effects may be that you get acne. That's one of the side effects. So those are some of the changes that happen in the skin.
Right, right, yes.
What did they recommend for you?
You mean in regards to trying to alleviate the scratching
Uh-huh.
or the itchiness? I'm sorry.
Yes.
Actually, the oncology nurse where I go, she suggested me using at least a few times a week Head and Shoulders.
Oh, no,
Okay.
no, I would not use that.
No,
Yeah.
okay.
Well, let me
but-
tell you why. Let me tell you
Okay.
why. The surface of the skin is different than the hair. Like water is pH of 7.5. Skin is 4.5. Okay. So what happens is they use that and it takes off the top layer, like it gets rid of the dead skin. And so you think you've eliminated the problem, but what happens is it dries out right underneath it. And then this just keeps perpetuating itself. It just keeps going on and on. It doesn't treat the problem. So I would not recommend the Head and Shoulders. I would
Okay.
recommend the moisture, 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 moisture. You can also use vitamin E. Vitamin E oil is great. You can
Oh.
use, we have hair and body oil that we use also. And I was having Jen use that. She had some excessive dryness on her scalp. And I said, Jen, you gotta use the hair and body oil. And I said, and I have a couple of different kinds that we carry here at the center. It's made with aloe and coconut oil, and it's fragranced with like pineapple and citrus, so it's not real strong smelling. And it's I have two different ones that I use on the wigs as well as on the skin. So if you want to use an oil, I would use something like that, or aloe. Aloe is also good for itchiness as well, but I wouldn't use Head and Shoulders.
So after the scalp is shampooed,
Yes.
don't use the conditioner?
No, you can use the conditioner. You can also, are you using the exfoliator?
I'm using that twice a week.
Right, the exfoliator?
Yes.
How often are you using the shampoo?
I probably wash my scalp 5 times a week. There's,
Okay,
there's
With that-
days when I don't.
with that shampoo?
With that, no, not with that shampoo. I also have, is that called Listen that you have there?
Yes, that's
Yeah.
exactly right. Do you have a
Yes.
conditioner?
I do.
And do you have the Listen conditioner?
Yes. Mhm.
All right, do you rub that onto the scalp?
I have, but then I was trying to do some reading and it said you really shouldn't use anything with alcohol on your scalp. And it has a little bit of alcohol. The conditioner does, just a little bit, I see.
Yeah, that's enough to, make it dry. That's why. So it rinses, so it rinses out the scalp. I would use the exactly what you're doing, but I would use the oil. We have an oil. Listen has an oil, a hair and body oil.
Okay. All right, I'll purchase some when I come in.
Yeah, I would recommend that. It's great. It's a great product and it works really well.